This is the story of a drug that was once hailed as a breakthrough for modern medicine. A drug meant to bring relief, but now it's causing a national nightmare. Today, we're talking about fentanyl. Fentanyl is one of the most potent opioids ever created, and it didn't start out as a street drug. Developed in 1960 by Dr. Paul Janssen in Belgium, fentanyl was first used in medical settings for pain management. It quickly became a valuable tool for anesthesiologists and doctors due to its fast-acting and potent nature. But over the years, this powerful drug has found its way out of the hospital and into the streets, where it's now one of the leading causes of overdose deaths in the United States. Fentanyl is part of a larger class of drugs, opioids. Opioids can be natural, semi-synthetic, or fully synthetic. Natural opioids come from plants like the opium poppy, including morphine and codeine. Semi-synthetic opioids like heroin and oxycodone are chemically modified, while fully synthetic opioids like fentanyl are made entirely in labs. Fentanyl is so potent that just 2 milligrams can be lethal. It can be injected, snorted, smoked, or ingested in pill form, and even small doses can cause overdose. Illegally manufactured fentanyl is often mixed with other drugs like heroin, cocaine, and counterfeit pills, making it even more dangerous because users often don't know they're taking it. This is where the crisis begins. Fentanyl's potency combined with its widespread availability on the black market has turned it from a miracle drug to a deadly menace. Now let's talk about something much darker. It's the role that foreign countries like China and Mexico, through Mexican cartels, play in the black market rise of fentanyl within the US. In the early 2010s, a third wave of the opioid crisis hit America, driven primarily by illicitly manufactured fentanyl, or IMF. This fentanyl wasn't coming from pharmaceutical companies. It was being produced in clandestine labs in China and Mexico, then smuggled into the US through the southern border. Mexican transnational criminal organizations, or cartels, are at the heart of this operation. These cartels have long controlled the flow of illicit drugs into the US, but fentanyl is different. It's cheaper, easier to produce, and far more potent than drugs like heroin or cocaine. 1 kilogram of fentanyl, which can cost as little as $5,000 to produce, can be sold for over $1.5 million on the US market. The Sinaloa cartel and the Jalisco New Generation cartel, or CJNG, are two of the biggest players in the fentanyl trade. The Sinaloa cartel, one of the oldest and most established cartels in Mexico, was once led by the infamous Joaquin El Chapo Guzman, now a former leader after his 2016 arrest. Today, the cartel is controlled by multiple powerful figures, including Ismael El Mayo Zambada Garcia, who has co-led the cartel for over 3 decades, and Los Chapitos, El Chapo's 4 sons, who continue to oversee the cartel's operations. Other prominent figures within the Sinaloa cartel include Aureliano Ahuel Guano, Guzman Loera, El Chapo's brother, and Rafael Caro Quintero, a notorious cartel leader. Together, they oversee a vast criminal empire that stretches across the Pacific coast and deep into the United States, targeting major cities like Phoenix, Los Angeles, Denver, and Chicago. The Sinaloa cartel is particularly active in smuggling illicitly manufactured fentanyl over the southern border, where they use tunnel systems and stage shipments near points of entry. These operations allow them to move vast amounts of drugs undetected, feeding the crisis gripping the US. The cartel doesn't just deal in fentanyl. They are also heavily involved in the trafficking of methamphetamine, marijuana, cocaine, and heroin. But it's their dominance in the fentanyl trade that is the most dangerous, particularly as they push this deadly opioid into US cities. Phoenix, Los Angeles, Denver, and Chicago are primary hubs where the Sinaloa cartel distributes its drugs. These cities serve as central points from which the cartel's products are distributed across the country. Meanwhile, the Jalisco New Generation cartel, or CJNG, is known for its rapid growth and violent confrontations with both the Mexican government and rival cartels.
These individuals are individuals that, quote unquote, they call them sicarios, trained assassins.
But that's just the beginning. This exclusive video taken from deep inside Mexico interior reveals a massive illicit narcotics lab hidden deep in the jungle, with raw materials imported from China through seaports controlled by the cartels. Members of the organization manufacture deadly drugs, including methamphetamine and fentanyl, all bound for the U.S. and beyond.
CJNG has quickly become one of the most powerful criminal organizations in the country, with operations extending into major U.S. cities like Los Angeles, New York, Chicago, and Atlanta. CJNG is highly active in smuggling cocaine, heroin, methamphetamine, and fentanyl into the U.S. The fentanyl coming into the U.S. isn't just smuggled across the land border. Precursor chemicals from China are shipped to Mexican ports like Mazatlan and Manzanillo, where cartels use corrupt government contacts to control these seaports. From there, the chemicals are transported to clandestine labs, where fentanyl is manufactured before being smuggled into the U.S. This vast, well-organized system allows cartels to flood the U.S. with dangerous drugs, all while making billions. The cartels are constantly evolving, adapting their methods to avoid detection. They use drones to drop small amounts of drugs across the border, catapults to launch packages, and ultralight aircraft to smuggle drugs through rural areas. And for every pound of drugs seized at the border, far more goes undetected. This is a massive operation, one that fuels the deadly overdose crisis sweeping the United States. In fact, the DEA has declared fentanyl as the most significant synthetic opioid threat to the U.S. today. And as the crisis deepens, the cartels continue to profit, transforming fentanyl from a medical breakthrough into a deadly menace. We've discussed the rise of fentanyl in America, but now it's time to focus on the grim reality, the death toll. Fentanyl isn't just the most powerful opioid, it's also the deadliest, and the data proves it. According to CDC data from 2013 to 2019, overdose deaths involving synthetic opioids, mainly fentanyl, skyrocketed. The most significant spike occurred in 2014, where deaths tripled, going from 1 to 3 per 100,000 people. But that was just the beginning of a deadly wave. By the time the study concluded in 2019, synthetic opioid-related deaths had surged by an alarming 1,075%. That's over a 1,000% increase in just 6 years. Another troubling insight from the CDC study shows that when synthetic opioids were mixed with drugs like prescription painkillers, heroin, cocaine, and psychostimulants, overdose deaths rose by a staggering 2,013%. This means that fentanyl's deadly reach isn't confined to opioid users. It's spreading across multiple drug categories, leading to deadly outcomes in unexpected ways. And here's a key point. Overdose deaths decreased by about 36% when synthetic opioids were not involved. This shows that fentanyl's presence in drug combinations is the driving force behind these tragic deaths. Now let's take a look at more recent data. The numbers from 2022 and 2023 reveal a terrifying reality. Synthetic opioids, especially fentanyl, have become the leading cause of overdose deaths in the U.S. In 2023 alone, an estimated 74,702 people died from fentanyl overdoses. To put that into perspective, the deaths caused by fentanyl are twice as high as the next leading cause, psychostimulants like methamphetamine. In 2023, there were an estimated 36,251 psychostimulant overdose deaths, a huge number, but still dwarfed by fentanyl's impact. And the other drugs, cocaine, prescription opioids, and natural opioids, are even further down the list. For example, cocaine overdose deaths were estimated at 29,918 in 2023, while prescription opioids caused around 10,171 deaths. Fentanyl continues to claim lives at an alarming rate, far outpacing every other drug. The devastation caused by fentanyl is clear. It's taking more lives than any other drug, and it's not just affecting one type of user. Fentanyl is infiltrating the drug supply in multiple forms, often mixed into other substances without users even knowing. So with thousands of lives lost each year to fentanyl, what is being done to stop this epidemic? The government's response has been swift, but is it enough? In the next chapter, we'll look at the role of law enforcement, policy changes, and the immense challenges they face in combating this deadly crisis. According to investigations, much of the illicit fentanyl and its analogs originate in China. From there, it's shipped either directly to the U.S. or funneled through transnational criminal organizations in Mexico, Canada, and the Caribbean. Once it reaches these destinations, it's pressed into pills or mixed with heroin, flooding the U.S. market where demand remains high. In some cases, traffickers even ship industrial pill presses directly into the US, allowing them to produce fentanyl-laced counterfeit pills domestically. Despite efforts to control fentanyl, traffickers are quick to adapt. Even as the DEA places fentanyl-related compounds under Schedule 1 or Schedule 2 of the Controlled Substances Act, manufacturers simply tweak the formulas to create new synthetic compounds, which evade legal restrictions. This cat-and-mouse game makes it incredibly difficult for law enforcement to keep up. The rise of the internet, particularly darknet markets and overt websites, has also allowed non-cartel-affiliated individuals to access fentanyl and pill presses. Traffickers can order these materials online, often using freight forwarders to complicate tracking by law enforcement. These packages are intentionally mislabeled or have incomplete information, making it difficult for authorities to intercept them. The DEA continues to work tirelessly to combat this crisis. The agency's Special Operations Division launched the Heroin Fentanyl Task Force, HFTF, bringing together multiple agencies, including the FBI and U.S. Customs and Border Protection. Their mission? To dismantle the command and control networks of international fentanyl trafficking organizations. China has long been a key player in the fentanyl crisis. Most of the precursor chemicals used to produce fentanyl originate in China, particularly in regions like Wuhan and Hefei. These chemicals are shipped to Mexico and the US, where they're used to manufacture fentanyl powder, pills, and analogs. One of the most impactful operations to date, Operation Blues Brothers, began with a tragic loss in Washington, D.C. A young mother, just 20 years old, lost her life to a fentanyl overdose. The investigation into her death unraveled a nationwide fentanyl trafficking network, revealing the dangerous connections between Mexican cartels and U.S. distributors. Operation Blues Brothers linked Mexican Sinaloa suppliers to wholesale distributors in Los Angeles and retail distributors in Washington, D.C. These suppliers flooded the streets with fake M30 oxycodone pills laced with fentanyl, which were promoted and sold through social media platforms like Instagram. The DEA's work uncovered how social media and encrypted apps are being exploited to market and distribute deadly drugs to unsuspecting users. The operation led to the seizure of nearly 95,000 fentanyl pills and almost 7 kilos of fentanyl powder, amounting to over 447,000 deadly doses. This seizure represented a significant victory for law enforcement, but it also highlighted the scale of the crisis. Just one network had the potential to distribute nearly 500,000 deadly doses. The fentanyl crisis may feel overwhelming, but there is hope. Across the country, communities, organizations, and individuals are stepping up to fight this epidemic and save lives. One of the most critical tools in this fight is Narcan. Narcan, also known as naloxone, is a life-saving medication that can reverse the effects of an opioid overdose in minutes. Free Narcan is distributed through clinics, by mail, in vending machines, and even at libraries. Harm reduction organizations in some states are ensuring that those in need have access to this life-saving medication. With continued action and compassion, we can turn the tide against fentanyl and save more lives. If you or someone you know is struggling with opioid addiction, resources and support are available. Check the links in the description of this video for more information on Narcan, harm reduction, and how to get help. Together, we can fight back against this crisis.